Working with trauma. The significant increase in research on mindfulness-based interventions since the first edition of this book has brought with it has been a great deal more awareness and attention to the potential risks or side effects of mindfulness practice for people with trauma histories. This is one of the most common questions we are asked at our trainings or conference presentations. Given the high rates of trauma in the general population, as well as the high co-occurrence of trauma-related symptoms in populations with substance use disorder, it's probably safe to assume that many participants in mindfulness-based relapse prevention groups have trauma histories that they may have previously self-medicated with substances. Although creating a safe environment is imperative for all participants, it's critical for those with trauma histories or for whom safety and trust are significant concerns. Above all, the intentions of the practices need to be kept at the forefront to cultivate curiosity, clear seeing, and compassion. We are observing our experiences, particularly those that are painful, with curiosity, presence, and gentleness, so as to practice a different way of relating to them. Although often uncomfortable and challenging, these practices should never feel threatening and are thus best fostered in a safe, supported context. Here are some specific ways to create such a context. Permission and choice. It's vital to all participants to offer them choices in how they practice and engage with their experience by providing options and using language that suggests an invitation rather than a command or directive, which may be experienced as authoritative, disrespectful, or disempowering. For example, the facilitator might say, "You may choose to keep your eyes open or closed for this practice. If you choose to close your eyes, know that you may open them at any point if this feels more comfortable for you. You are also welcome to adopt any posture that is supportive and comfortable for you, including sitting or standing up. We also need to recognize that sensations of breathing may not be a neutral anchor for some people, and that other anchors, such as the soles of the feet on the ground or the sensations in the hands, are equally suitable options." Zones of engagement. Although many mindfulness-based relapse prevention practices involve approaching experiences of discomfort, it's equally important, and perhaps even more so for those with trauma histories, to learn to bring awareness to internal cues, to step back when something is overwhelming or no longer allows for kindness or stability of attention. Learning this may require some practice and may need repeated encouragement. It can also be an important vehicle for healing, especially for those who have experiences of feeling unsafe in their bodies, having boundaries violated, and experiencing general disempowerment or lack of agency. Relatedly, it's helpful in the first session or two, and especially in the context of the urge surfing exercise, to discuss the 3 zones of engagement. These include habit, comfort zone, where we avoid thoughts, feelings, and sensations that are challenging, but where there's little to no growth. The challenge zone, where we might experience discomfort, but it's workable and there's potential for change and growth. and the zone where we are in a state of overwhelm. This last state is not productive and may actually cause damage. These zones are similar to the spectrum of physical exercise and health, where sitting on the couch may be comfortable and feels safe, but does not improve strength or flexibility. If we push ourselves too hard, however, we might risk tearing a muscle or harming our bodies in some way. There's a middle zone where we can gently challenge the limits of comfort in a way that improves our strength and flexibility. This is where optimal growth and strength building occurs. Several of the practices and exercises in MBRP invite us out of our habit zone, comfort zone, into the challenge zone, and thus may involve some uncomfortable feelings and sensations. This shift in our relationship to discomfort and stretching of our capacity to be with, instead of immediately reacting or attempting to fix, is at the heart of MBRP. However, this is not the same as diving into the deep end or having forced contact with something that's overwhelming or harmful. Challenge must be balanced with skilled kindness. This might include taking an intentional step back from a potential overwhelm by opening the eyes, focusing attention on the feet, hands, or the breath, bringing awareness to sights and sounds in the room, and or moving around. We frequently remind participants that these techniques are available to them. Modified practices. The practices in this book, both structure and wording, are based on our experiences with participants with whom we have worked. However, as this program becomes more widely used, we recognize this and support the need to modify structure, form, language, and style to best suit the individuals engaging in them. If we as facilitators understand the intentions of the practices, we also understand that the way in which they are presented can be flexible. There are many ways to practice placing attention onto physical sensations in the body, for example, or to practice observing thoughts in the mind rather than getting caught up in them. For example, as discussed above, for participants with trauma histories, closing one's eyes or lying down may be overwhelming or threatening. Practicing sitting in a chair or even standing, especially with practices like the body scan, and keeping eyes open during practices should be offered as options. When we're working with youth, we often have difficulty with the longer practices, in which instructions are often about stillness and bringing awareness to more subtle experiences. Practices might involve more movement and playfulness, or be broken up into shorter segments of instructions. We might offer movement or walking instead of sitting or body scans for daily practice.